Good afternoon, everyone. Thank you for joining us again. This is our final session for the Christian Unity Gathering, and then we will have our closing worship service together this evening at 7. This is a panel that we felt was so critical to this moment that we're in as we talk about being in new wineskins. As we look at where we are in our world, we know that we are still dealing with this global pandemic from COVID. And we wanted to just have an international briefing to update where we are and what other things we might need to do. So I am going to be happy to turn this panel over. But first, I want just to turn it over to President and General Secretary for the National Council of Churches, Jim Winkler, who will have some words to say about a special effort that we've been involved in during this COVID pandemic, and particularly as it pertains to the vaccines. Jim?
Thank you so much, Leslie. Early this year, a multi-faith effort got underway, particularly of Muslims, Christians, and Jews. We called it Faiths for Vaccine. And we've had countless meetings over these past 10 months or so as we've tried to connect houses of worship with local and county and local, county, and state health departments. So because we believe that we have enormous capacity and that we're trusted messengers and that we can help with the distribution of the vaccines. I think that our effort was successful. We met many times with federal government officials, including Dr. Francis Collins, who's part of this panel. And now we've turned our attention to pushing for global vaccine distribution. Our country here in the United States has enormous capacity to provide vaccines, and this is a matter of justice and a matter of public health, something that we all need to be part of. I know that Orthodox churches, Black churches, mainline churches are among those that open the doors of their houses of worship to act as vaccine distribution sites. I don't know how many vaccines were administered through local churches. I know I got my vaccine at a local congregation in Alexandria, Virginia. But I am grateful that we got together, that we helped to mobilize houses of worship, that we worked with government entities, and as well as with private companies like Walgreens and CVS and Rite Aid and so forth. I want to note that one of our award winners from earlier this afternoon, Dr. Barbara Williams Skinner, was a very important part of this Faiths for Vaccine effort. And our own governing board member, Reverend Dr. Terry Hord Owens, was frequently involved. A lot of people were involved in this effort. And finally, I want to give a shout out to two of my colleagues who are going to be part of this panel, Reverend Joel Dopico of the Cuban Council of Churches and Reverend James Bhagwan of the Pacific Conference of Churches. We have been in touch frequently over the last few months as they have been working in their part of the world to combat the coronavirus pandemic and to persuade people to take the vaccines. So thank you so much, Leslie, for inviting me to say a few words about this multi-faith effort, Faiths for Vaccine.
Thanks, Jim. That was great. It was a wonderful effort to be involved in. And now, without further delay, I'm going to turn it over to a sister and friend who is also on the front lines of doing work not only for the National Council of Churches, she's on our governing board, but also the World Council of Churches, and you name it. She is Reverend Dr. Angelique Walker-Smith. She serves as a Senior Associate for Pan-African and Orthodox Church Engagement at Bread for the World, but she also does so many other things and wears many other hats. We are so glad to have you join us, and she will serve as the moderator for this panel. Angelique?
Dr. Copeland-Toon, thank you so much. And Reverend Winkler, or I shouldn't say Reverend, I guess it's Dr. Winkler. I know you have honorary degrees or earned ones. And to, of course, the board chair, John Dorhauser, and of course, to Bishop Teresa Jefferson Snorton, to the governing board, and to all who are part of the NCC work and our friends. We are so delighted for this Christian gathering. Let me just commend, if I may, this wonderful time we have had together thus far, wrestling with really hard issues that really must be wrestled with as people of faith. So I want to commend the CUG for doing so. Kudos, and let's keep the faith. God bless you. Today, we're going to be looking at another difficult issue: global inequities in the global space around vaccine accessibility. But we're also going to look at the issues of vaccine equity in the United States and in, if you will, the wider domestic space, not just on the mainland shores, but the off-mainland areas as well. We're going to receive global perspectives from faith leaders from Cuba, from Africa, also from the South Pacific. But we're going to begin our time with an authority who's in the house. We are so honored to welcome Dr. Francis S. Collins, the medical director for the National Institutes of Health. Now, hold your seat, he's leaving. But for now, he's with us, and he's been with us working on these issues. And I hear nothing but real kudos, Dr. Collins, for what you've done. And we're looking forward to your opening remarks. We know that you may have another engagement to go to. We want to respect your time and to appreciate what you have done and what you are doing. So thank you, Dr. Collins, for joining us. Let's begin with you, and then we'll further the conversation after that. Dr. Collins, the floor is yours. Thank you.
Well, thank you so much, Reverend Dr. Walker Smith, and hello to all of you. It is a great privilege to be able to join this panel for the National Council of Churches, an organization that I have great respect and admiration for, and I'm happy to have been able to work alongside you over the course of this pandemic as we've tried to figure out how to bring saving vaccines to people to prevent the terrible loss of life that continues to happen, especially with the Delta variant, which has now become the most significant reason for this pandemic to continue in lots of places. Yes, I'm a scientist, I'm a physician, but let me also say that for this organization's principles, I'm also a convert to Christianity at age 27. I'm a follower of Jesus, and I am glad, therefore, to have the chance to put all those things together in the remarks that I try to give you all at the beginning of this panel. So it is the case that we have had the remarkable blessing of vaccines emerging that turn out to be remarkably safe and effective in the space of just 11 months last year. We went from just learning about this virus, SARS-CoV-2, to having 3 vaccines approved in the United States under a very rigorous regulatory system run by FDA that are found to be safe and effective to prevent symptomatic illness, especially serious illness, and also have a very good safety record. Not to say that there are not occasions where maybe 1 in 100,000 people might have a rare event, because that happens with almost everything, including aspirin, by the way. But for the most part, these are remarkably safe and remarkably effective. I guess one of the big reasons we got there so fast is this new technology of messenger RNA, which makes it possible very quickly, when you have seen the letters of the code of a virus, to be able to make a vaccine almost the next day, or to design it. Maybe I would think, therefore, in the context of Luke 5:37 to 39, which I know we are focused on for these 2 days, that that's the new wine, and we want to put it in the appropriate new wineskins, which might mean all the people of the planet, because of its opportunity to provide protection. You know, Christians have always had to face plagues down through history. This is not the first one. It won't be the last. Christians have distinguished themselves in plagues. When others were running for the hills, Christians have often run towards the danger, trying to figure out how they could help those who are suffering, how they could limit the way in which that plague is taking lives. I would want to see us continue that tradition, and many are doing so. In the Faiths for Vaccines effort that was described a minute ago by Jim Winkler is a great example of how faiths are gathering together to try to promote answers to this. So there is lots to say here about the good news of our situation. For me as a Christian, having prayed for answers to COVID-19 that would save lives, the vaccines quite literally feel like an answer to those prayers. And yet we know that not everybody sees that way, and that there are certainly Christians who are suspicious about the vaccines, hesitant to take advantage of them, and who are therefore very much still at risk without that protection. So I would say, for my little opening remarks here, there's one bit of good news and a couple areas of concern. The good news is we have, and we had no right really to expect this to happen so successfully. We have vaccines that work and they're safe, and they are being produced in increasingly large quantities, including quantities that can now be shipped to other parts of the world, although I wish we were further along with that. But there's no question that we have a solution here in terms of prevention. That's the good news. The first bit of bad news, I'll talk about our own domestic situation here in the United States. We still have 68 million people who, despite the fact that the vaccines are free and are available in no less than 70,000 locations across the country, so that almost everybody lives within 5 miles of a place they could get their shots. 68 million have not yet taken advantage of that. And polls would say that many of those people are actually not just forgetful, not just haven't got around to it, but are actively resistant. Much of that resistance feeds into conspiracies and misinformation and, frankly, disinformation that is spread particularly through social media and the internet. But it's also true that evangelical Christian communities have been particularly amongst those with the greatest resistance to this. Suspicion of the government, distrust of science, and a sense perhaps in some of those individuals that by accepting the vaccine, they are somehow trusting less in God because they've prayed to be protected. And if they roll up their sleeve, does that mean they didn't actually believe God could help? I've heard that repeatedly. I must say, as a Christian myself, I find it surprising because, you know, when we pray to God for all sorts of things, God has ways of answering, and those answers often come through people. And this seems like a case in point. How do we get to do science? We get to do science because God gave us the gifts to understand the natural world which he created and which has this property of being ordered so that you can understand it using experimental science, and you can learn about things like a virus, and you can develop an approach to try to prevent it. All of that's a gift from God. I think of a scientist in the laboratory is sort of like also being in the cathedral. You're learning things, you're worshiping by understanding creation, and to have then come out of that something that's life-saving feels very much like God's grace being showered down upon us. But that is not the way, unfortunately, that lots of people have been seeing this. And so we continue to see in the United States a terrible and unnecessary tragedy. We are losing still today, even though we're on the downward slope of this awful fourth surge, yes. Now driven by Delta, we're still losing between 1,000 and 2,000 people every day dying from this disease. The vast majority of those people are unvaccinated. Those are preventable deaths. They didn't need to happen. So again, the church, I am so grateful to all of you, and the National Council of Churches has been right out in front on this, trying to get the message across that this is something you want for yourselves, for your family, for your community. But we've still got a ways to go there with lots of folks who have not yet been convinced of that. How do we convince them? I think you all have the credibility. You have the trust of communities that frankly aren't going to look at me as a government employee and go, oh yeah, I'll go along with him. They're going to look at their pastors. They're going to look at their physicians, maybe the nurses around them, community workers, people that they know are basically not invested in anything but helping them, and they're going to listen. So don't slow down, please. I think we still have a terribly difficult challenge ahead of us because we're at the point now where those who are not yet vaccinated are amongst the most resistant. I don't think you win them over without a person-to-person interaction. And it's often the stories that convince people. And there are plenty of stories, heartbreaking stories, of people who thought their vaccine was not for them and are now writing their final message in a text from the ICU to their loved ones as they are about to realize they're losing their battle, and their loved ones can't even be there with them around the bed because of the danger of infection. Those are just heartbreaking stories and preventable ones. So thank you for all you're doing. But now the focus of this panel is on the international aspects of COVID, and particularly the need for vaccines to be distributed everywhere. When I became an NIH director 12 years ago, I had a series of 5 areas that I thought ought to be priorities. 4 of them were pretty predictable, sort of basic science and translational science and clinical science and training. The one that surprised people was global health research. That is, for me, a passion. I've spent time myself volunteering as a missionary doctor in Nigeria. I learned a lot from that. I've worked with others to try to see what we could do to build research capacity in sub-Saharan Africa by a project called H3 Africa. And that's made great strides in beginning to get that capacity to grow, which we need to continue to sustain. And so my heart breaks when I see that while we here in America, with all of our resources and all our benefits, have free vaccines for everybody who wants it, still we have people turning it down, and people in many other countries, particularly low and middle income countries, look longingly at our situation and wonder, how could those people actually justify declining what we so desperately need, and when will we have our chance? Now, the United States has distinguished itself in this effort, but it's a very steep hill. As of today, the United States has committed to 1.175 billion doses of vaccines to send to low and middle income countries, of which 175 million have already been shipped, and the additional 1 billion will be coming forward in the coming months. That's more than all the rest of the countries of the world together as far as donations. We've also donated $4 billion to COVAX to enable them to find additional vaccines and distribute. And we're working with our colleagues in Asia, namely Japan, India, and Australia, the so-called Quad, to see what we can do to further expand vaccine manufacturing capacity in that part of the world where it's much needed. And I've personally been involved on multiple occasions, will be again tomorrow, with an effort in Africa trying to build vaccine manufacturing capacity, which already has made some inroads in South Africa, a little bit in Rwanda, and increasing opportunities in Senegal. But those will not be online quickly enough to fill the urgent present need. And so the main way in which vaccines are going to reach low and middle income countries, at least in the next year, are going to come from the existing manufacturers who need to be urged in every way. And that means, in the case of the US government, money to buy doses to expand their capacity and get those doses into arms as quickly as possible. This has to be a high moral responsibility for our country. And I believe the current leadership in the White House shares that sense of responsibility, but it never happens as quickly as you would like. So I think, again, we have some good news. We have some hard work to do. I'm glad to be with you all, and I particularly want to hear from those who are out in countries where the vaccines have not yet really reached them, and to hear what more we can be doing to try to accelerate this process to save lives, because we've lost more than 5 million people to this pandemic, and I don't want to lose any more than we absolutely have to. We need to press this forward with the maximum speed. So with that, I will give this back to you, Reverend Dr. Walker Smith, as our moderator to decide how you want to proceed.
Dr. Collins, thank you so much. I want to appreciate your pointing out both the positives and the negatives, where we are, where we need to go, and to say straight on, we must face it as a moral question, and we must also face it as a medical urgency. So I want to thank you very much for your honesty in that regard. We will come back to you with further questions. I'm trusting that you're able to stay on longer, if that's agreeable, because we certainly want to hear from the global space around their responses relative to the comments that you've made as opening perspectives. But thank you again for coming right out the gate, saying there are positives, there are negatives, we must face them as people of faith. We are delighted also, in addition to our distinguished guest, Dr. Saunders, to have other distinguished guests from the global space as well. We will hear from Dr. Pauline Muchina. Dr. Pauline Muchina, born in Kenya, but also living in the US. She's truly a Pan-African woman for me to describe her. I've had the great pleasure of working with her on any number of projects. She's with one of the member churches of National Council of Churches and the American Friends Committee. And she also is the convener for the COVID-19 working group of the Advocacy for Africa Network. And she will come and she'll give comments, but I also want to also introduce the other speakers quickly, and then we'll take them each one by one. We also are very blessed to have with us the Reverend James Bhagwan. James and I also have had opportunity to work together. He is the leader of the South Pacific Council of Churches, doing a great work there. And he, as Mr. Winkler said earlier, he was one of the speakers, as was Dr. Muchina, in that earlier call this summer around the issues of global inequities around the vaccines. So Reverend Bhagwan, we welcome you back to this ecumenical space and interfaith space, if I may say so. We also are going to be welcoming the leader of the Cuban Council of Churches, and we are hopefully going to have a sustained signal so we may hear his very important inputs from just south of the border. I know Cuba has historically been a very important ecumenical partner in the work in the United States and of course, globally. So we will be welcoming the Reverend Joel Ortega Dopico. We will begin with our comments on Dr. Muchina, and then we will go from her over to Reverend Bhagwan, and then we'll come to you, Reverend Ortega Dopico. So Dr. Muchina, please, the floor is yours. Thank you so much. I believe you're muted, Dr. Muchina.
Yes,
sorry.
I just saw that. Thank you so much, Dr. Angelique, and also the National Council of Churches for the opportunity to bring the concerns of the Africa continent to this platform as we talk about COVID-19. Most of you think that Africa has not been impacted drastically by COVID because of what you're probably seeing in the news or what you don't see in the news. So it's so hard to tell what is actually happening there. So I just wanted to begin with bringing the fact that over 6 million people in the continent have been infected with COVID, and we've had 147,786 deaths. We know that 47 countries are currently going through the third wave of the pandemic, which means Delta is the dominant variant. And we also know that most of the continent is not vaccinated. Actually, only 15 countries have vaccinated 10% of their people. The rest are not, the rest of the countries have less than 2% of their people vaccinated. COVID is, causing havoc in the continent. If it is not dying from COVID itself, it is definitely being affected and sometimes starving and sometimes dying because of hunger, because of poverty, and because of insecurity also in the continent. Therefore, when we talk about COVID, COVID is not just a health issue in the continent of Africa. It is also an issue of economic empowerment. It's an issue of security. It is an issue of food. As most of you know, many Africans right now, are dealing with the fact that COVID has done a number on the economy of the countries. And therefore, there is a huge economic downturn. The lockdowns, which saved most of African countries from being devastated by the pandemic, are also now causing havoc now. If they had not locked down their countries for some time, then more people would have died. So there is a pandemic of poverty going alongside the pandemic of COVID in the continent. And it is devastating. Just recently, my sister called me and told me she's shutting down her business of 20 years because of COVID and because there's no business. And she's just one of the millions of Africans that are suffering My friend has lost 3 members of his family, his mother, his cousin, and his uncle, and his dad is now sick from COVID. So Africa is being affected by COVID even as we speak. And COVID comes to Africa where it's not only poverty, but also weak health infrastructure. So the way it has impacted the continent, it's impacting other health issues in the continent. For example, AIDS or HIV is very prevalent in the continent. We wonder why South Africa has been the country that has been devastated the most in the continent, but majority of the people who have HIV in the world today are in South Africa. So they have immune compromise already, and COVID is just adding on to that. We have things like malaria in the continent also. And the thing that COVID has done is to make it impossible to access some of the health services that people need on a daily basis. For example, sexual and reproductive health for women has been impacted by COVID, and therefore we see more women not being able to access sexual and reproductive health services because the whole health infrastructure is focused on COVID right now. We see immunization programs in the continent also being affected. We know that the stories of pain and suffering may be a little bit less compared to the United States, where you have lost, or we have lost 700,000 people. But when you look at the impact, because the other story that is not being told about the continent of Africa is that we don't have good data collection. So we really don't know how many people have been infected or how many people have died of COVID. But I know friends and family from Africa, I come from Kenya, are saying we are burying more people this time period. They may not be tested for COVID, but they are dying during COVID. So most likely, like my aunt whom we lost last year was COVID, but we were told, oh, she had a fever, but she was not tested. So we will never know what really killed her. And that goes on in so many places. I do acknowledge Dr. Collins' mention of the Biden's administration contribution to vaccines donations. And I say, kudos to the administration, and say 2 things about that. One is that, the promised vaccines have begun saving lives because people in the continent are receiving vaccines. But I do want to caution us that vaccines are not donated vaccines are not going to save the whole continent of Africa. We have 1.2 billion people, and all of them, only about 3% of that have received vaccines so far. So we do need to hasten the manufacturing capacity of companies in the continent to be able to produce the vaccines themselves, like in South Africa, in Senegal, in Rwanda, and other places that CDC has identified. I also want to say that even though those vaccines, 1.something billion has been promised, only less than a quarter of that has arrived. And when we look at what really is causing the shortage of vaccines, the problem is manufacturing capacity of the companies that already have the technology. Therefore, that's why we are requesting, and we've been pushing, and we had a vigil. The faith community is pushing for the TRIPS waiver at the World Trade Organization, so that we can get, temporary TRIPS waiver where other companies can manufacture the same vaccines in different parts of the world, or even United States itself. Why does it have to be only these 3 companies that own the patentee that produce them? We need more companies because they cannot scale up to the point where we can actually save billions of people globally. Then we are also saying that we know that these companies are driven by profit, but the US government is not driven by profit. And therefore we are asking or requesting the US government to step up their efforts at the World Trade Organization in advocating, in supporting the TRIPS waiver, which is possible. And also not just the TRIPS waiver, but also the medication, like the one just came up, the Bhagwan to treat COVID, and but it will not be available in the continent of Africa for many, many months to come. So my question is, how many people do we have to lose this time around before we can share the technology of producing the vaccine? During the AIDS pandemic, we lost 30 million people, and majority of them in my own continent, while we were still talking about do we give the waiver and all of that. And finally, there was compulsory license, but it wasn't able to save the 30 million that died. But fortunately, we've been able to save other millions who could have died if that wasn't done. So now the ARVs arrived in the continent, and through PEPFAR funding, we were able to save more lives. COVAX is right there now. It is still underfunded. And at the same time, they have no vaccines to buy because countries in the Western world, the UK, Germany, Canada, Switzerland, United States, they are hoarding the vaccines. And while President Biden has said yes to support the TRIPS waiver, he hasn't been pushing as hard as they can as an administration. Countries that are saying no, like Germany and UK, Canada, and Switzerland, have people of faith in those communities. So here is my question to the faith community. During the AIDS pandemic, we let so many people down. First, it was stigma within the Christian tradition and other traditions. And then it was, a campaign against condoms, which scientists had said that it would save people's lives. And now, it is about COVID vaccines, and we are not fighting as much. And where we are not fighting, we are allowing people to go without a life-saving device, which is the COVID vaccine. At the same time, there are Christian traditions also that have been upfront in condemning the vaccines from their religious perspective. And that also, I see it as when they were refusing to use condoms. And I just want to end this session, or rather my presentation, I know we'll have time, but to remind all of us that we are one body. We as Christian, me as a Christian, I belong to the Christian tradition, that when we think of the text from 1 Corinthians about, being one body of Christ, and if one part of the body suffers, then we all suffer. If we are not saving others, helping with vaccines, and not just sending donations, but TRIPS waiver, then we are not one body of Christ. We are failing the body of Christ. And this time, we need to wake up as Christians and do better than history, than the way we've acted in history. And I want to say thank you to those who have been upfront also advocating with us. Thank you very much.
Well, Dr. Muchina, of course, you've been most articulate about, again, what the challenges and the opportunities are. And just like the rest of the CUG, you pointed to the historic inequities that the vaccines have exposed and have deepened relative to this pandemic that all of us are facing. You've also pointed to the important part of urgency, not only in your tone, but in your voice, but also based on lessons learned. Lessons that we've learned from the AIDS pandemic, the AIDS epidemic, we should say, and then other medical challenges that have come to the continent, but not only to the continent. Dr. Collins already raised, we've always been suffering with plagues and humanity. I mean, we need only look to the book of Exodus and we know all about that, right? So this is something we are living with. This is something we have lived with. The question becomes, what can people of faith do to be proactive, knowing that the plagues are real? Epidemics, pandemics will be here, are here, and have been here. And so the faith community has had major pioneering efforts on health, hospitals that faith leaders have built, science that has been funded by faith leaders. So the faith community has been there, but the question is, where are we now? Particularly in places where the one body is experiencing all this pain. and even death. That is the moral question that is before us. So let us travel now to the South Pacific and see where we are in the body in the South Pacific. Reverend Bhagwan, you bring amazing gifts and skills to your leadership. We're delighted to welcome you. We thank you for being with the faith community globally this past summer. And we're looking forward to what comments you would add coming from the South Pacific around this theological concept of, yes, we are the one body, and we do have a commitment to each other, the inequities, and then also the opportunities. So please, Reverend Bhagwan, if you can help us from the region in which you live. Thank you so much.
Thank you, Angelique. It's always a pleasure to join you in these conversations virtually. I look forward to one day having face-to-face conversations again. I just would like to acknowledge that I might need to turn my camera off at some time because of the connection here. And so I'm going to go ahead and do that just to make it clearer for you to hear me.
We appreciate
and that's
that.
because I'm speaking from the North Pacific today, from a North Pacific city called Los Angeles. I've just flown into Los Angeles airport from Fiji en route, a very long route to Glasgow, which will eventually end up in Glasgow. So it's my first international travel in 20 months. Very interesting COVID-safe protocols. The good Dr. Francis would be happy to know that lots of protocols are in place. But if I may really add on to what Pauline has shared earlier, in terms of where we are in our region. I come from an island community in Fiji, which has just reached 80% of its targeted adult population being vaccinated. But still, we have a lot of vaccine hesitancy. And although we have done our best over the last year to counter some of the theological concerns, we cannot compete, unfortunately, with, and it pains me to say this in this conversation, a lot of disinformation that is coming, or deliberate misinformation that is coming through the United States, through certain sectors of the Christian population. And this is picked up by our diaspora in the US and then filtered through to our communities. And so we continue to face that challenge. The other is, of course, and this is something that we really, in my pastoral work, only discovered quite recently, that those of us in our sort of late 40s and 50s who had inoculations when we were in our first year of what we call primary school, elementary school, there's a lot of people who are actually traumatized by the size of the needles that they had back in those days, in the 70s and in the 80s, and have disguised their fear of needles using every excuse in the world. Nevertheless, we continue to see the rollout of vaccines, particularly through the COVAX in partnership. And this is really to add to what Pauline was saying about the need for countries to continue to support the rollout of vaccines across the world. Particularly Fiji and other Pacific Island countries were supporters of the TRIPS waiver. But we have seen what we call in our region vaccine diplomacy. And this is countries using the procurement and distribution of vaccines as a means of creating and strengthening their relationships with Pacific Island countries, particularly in the context of the Indo-Pacific narrative of the US, Australia, the UK, Japan, China, India against China. And so we see this as a larger play within the global global geopolitical scenario, and that is quite concerning for us. And so in that context, when we talk about new wine into new wineskins, we see the new wines of the vaccines fitting into the old wineskins of colonialism and neo-colonialism. And we need to be quite cautious about that. And so in our context, as we reflect globally, reflect to the Northern Pacific, we see the impact of the geopolitical scene playing out in the situation of access to vaccines. In the same token, our region has pretty much been shut down, and we have shifted from trying to keep COVID out of our region to finding a way to live with COVID. That is the new normal for us in the Pacific. Many Pacific Island countries are dependent on tourism, and so are slowly having to figure out how to reopen their countries safely to ensure the economic well-being of their people through the tourist industry. As I said earlier, I've come through LA on a very long journey to COP for meetings along the way. And even the impact of COVID in terms of how we negotiate on the issue of climate justice. And so we are finding out that this year, many delegates from all over the world, particularly from at-risk communities in the Pacific, in Africa and Asia and other places, will not be able to attend COP26 in person. And this is not, as many people know, just a normal conference. These are negotiations that take place, particularly at this time, about the ambitions, the Paris rule book, and really what needs to urgently happen in order to protect our planet, our common home. And so we find that many Pacific Islanders or Pacific Island nations are not able to send their negotiators. We are seeing they're having to send their permanent representatives from the UN in New York across. And it's going to be a struggle to get strong negotiators from the most affected countries to speak to this issue. And so when the opportunity for me came, although it's a long and challenging journey, I had to say yes, because those of us who can get there must get there to make this count. And so within the rush to get back to normal, these are things that we also must take into consideration. While we want to reboot economies, we have to be mindful of the larger issue that is at stake, and that is the future of this planet. And so for us in the Pacific, there are a lot of things that we have to navigate. There are a lot of reefs and storms that we have to navigate our Pacific canoes in order to not just sail into a place of peace and hope and life-affirming community in the time of COVID-19, but also in the context of climate change, also in the context of the geopolitical scene, in which we are just often just seen as empty water, in which these activities take place, and of course extractive industries, where industries and companies push their own agenda through our governments, who are desperate to get their economies up and running as well. I think I'll leave it there, Angelique, and thank you for this opportunity.
And thank you so much. And we do appreciate your not being able to share your video, but of course your photo is serving very nicely. I really want to thank you for this metaphor that has been used throughout the CUG of new wines in the old wineskins of colonialism. I just think that particular statement connects the dots with the CUG. And it goes to the points that Dr. Muchina was talking about the historic inequities and the exposure of that we're in this new moment. Yes, we have the vaccines. But where is the host? I mean, where is this new vaccine being received? And it is not being received in most of the world. And so you're connecting those dots in a theological, biblical way, but also in a very real way on the ground is really very helpful. And we want to thank you very much for your perspectives relative to climate, because we know climate is one of those intersectional issues, and it has to be discussed. And you're right, these historic global meetings do matter. And that's another urgency that we're facing in this moment, where COVID, the vaccines, find that kind of intersectional space that we need to be wrestling with. You mentioned many other things, but we'll come back to that. But I just wanted to bring those things into light as well and with more focus. Let us move now to Cuba. Let us move to the Reverend Ortega Dopico. Reverend, are you there? I know we had some technology challenges moments ago. Hopefully, we've been able to address that. Is that the case? Are you there, Reverend? Can you unmute your line, please?
Yes.
Oh,
You hear
that's
me?
so much better. Nice work. Thank you.
Do you hear me well?
I hear you very well. I'm so delighted. Welcome, Reverend.
Thank you. My apologies in advance because Zoom is prohibited in Cuba because of the embargo. So we are using a VPN and some kind of technology to be connected. First of all, I want to appreciate the churches in the US and the ecumenical movement for all the help and support standing with Cuba during this very difficult time of these past 2 years of the COVID-19. The first
Reverend Ortega, you may need to do what Reverend Bhagwan did, which is to put your photo and bring your audio. This is fully embraced as an option. Reverend Ortega Dopico, are you there? Well, friends, we seem to have lost the signal for the moment, but not to despair. He came back before. We pray he'll come back again. I would like to move on to Dr. Collins, please. Dr. Collins, you've heard these voices from the global space. There are other global spaces we could name as well. I'm sure we'll find some similar concerns that are raised. And certainly in your area of work, I'm sure you're aware of some of these things. What would be your response to some of the threads you've been hearing relative to these global communities that are a part of our one body as people of faith?
Well, the comments have been very powerful and very appropriate. We haven't heard from South America, but obviously Cuba's got some connections there in terms of language and other things. And certainly South America and many of those countries are also in a difficult situation with limited access to vaccines. And that would also apply to other countries in South Asia as well. So yeah, we have a very heavy lift in front of us to try to figure out how to up the output of the manufacturing and then to achieve effective distribution. I wanted to comment on the whole point about TRIPS, this effort which has been endorsed by the president to basically make an exception to the usual limitations on access to intellectual property in order to try to inspire manufacturing to happen in other places than the 3 countries that we are aware of that right now, I mean, the 3 companies that right now are doing the majority of the manufacturing for the US and a few others outside. And I think this is something in the long run that will help. But I think we got to be clear that if right now that were passed by WTO, the people I've talked to who have a lot of reasons to know about this say we'd probably be at least 2 years away from seeing a substantial increase in vaccine production from places that aren't yet doing it. It's just a very difficult high-tech effort to set this up. Furthermore, it needs actually technical advice from the companies that know how to do this. It's not just enough to have permission. You need the experts, you need the training. So we don't want to alienate the companies that have that expertise. We need their help too. We can appeal to them on moral grounds that this is something they must attend to. And they're variable in their response. I will say J&J has been particularly attuned to the importance of global access. And they, I think, deserve some credit for that. Pfizer and Moderna, maybe a little less so. Maybe a lot less so in the case of Moderna. So we have the opportunity, I think, to try to use the moral persuasion to convince them to go further. But please, let's not be naive and imagine that we could turn on a dime and produce those vaccines in the next few months. It simply won't be possible to do that. So the main way we're going to get vaccines into the arms of the people in low and middle income countries is going to be by increasing the production of the companies that are already doing this and just getting them to do a whole lot more.
Dr. Collins, thank you. We'll come back to you, but I'm pleased to welcome back Reverend Ortega Dopico. Reverend, if you want to use your photo as opposed to audio and the video, I know that helped Reverend Bhagwan in the Pacific. That may help you, but just to say you have options, we certainly want to hear your voice.
Yes, thank you very much. So I can say that Cuba is developing their own vaccines because all the situation we've been living, you know, the embargo, the blockade against Cuba from the U.S. administration, the new sanctions from Trump's administration, the placing Cuba in the list of terrorist country. All of this is being making very difficult for Cuba as a country to manage the COVID-19 pandemic in the island. Despite of all of that, as I mentioned, we've been developing as a country our own vaccines. Today, 9 million of people in a population of 11 million and a half is being under the first shot of any of the variety of vaccines we've been developed, and 6 million are under the second shot of vaccine. We also started as a country doing a vaccine for children under 2 years old. So in the past months, we've been living a crisis, but now all the numbers are getting down and down and down. We've been lost about 8,000 people died during these 2 years. Imagine for Cuba, the whole medical system is free, how heavy it's been for the authorities to keep all this going on. The economy of Cuba is being very depressed because we've been mainly living by the tourism, one of the main, so from 4 million of tourists coming to Cuba every year, we get down to about 20,000 tourists. So you can imagine what dramatic it's been for the Cuban economy, all of that. So we are living in a moment of a lot of problems and complexities with the access of food and other supplies. But the vaccine, that is one of the subjects that we've been talking today, we are very well on that. We have all the vaccines we need for the Cuban population right now. As I mentioned, 84% of the population is receiving one shot. Also, we are sharing the vaccine with other countries like Vietnam, Venezuela, and I believe that about 10 or 20 more countries are evaluating the possibility to receive the vaccines that are being producing in Cuba. As I mentioned, five different vaccines. Also Cuba is being sending doctors to different countries, but we have an international program that we send brigades of doctors to countries to help with that as well. The churches in Cuba is being very involved, producing a mask, artisanal mask. You can imagine we don't have too much access to get masks, so many churches being using sewing clubs, producing masks. Also, we've been using some churches for center for vaccine the people there, and also some churches and even the Evangelical Theological Seminary of Matanzas, one of the most important ecumenical centers in Cuba, being using as a hospitals, mainly for children during the strong crisis, because the hospitals were not enough for receiving all the people that was illness in the past months. Now it's getting better, but the churches being in Cuba very involved in the support to the community, creating a space of trust for people to come to be vaccinated, and places also to receive people as small hospitals in some of our church buildings and facilities. So this is being how Cuba being respond. We are living in a critical situation, Economically speaking, the access to food is very hard today in Cuba, but we have the vaccine, we have the facilities of the hospital. Also, we have not too much medicines. It's a strong crisis because we are in need of medicines today. I am talking about simple medicine like ibuprofen or colostomy bags or simple things. Also, we've been receiving lots of solidarity from churches in the United States sending medicines to Cuba today. We've been receiving like more than $1 million in medicine from churches in the US, and also syringes. It was a campaign to send syringes to Cuba. So in the middle of all of this, we've been experiencing the love of God, the solidarity, the encouragement of people. So, and also we've been having the opportunity, despite of the critical situation we are living in Cuba today, to share what we have, not just as churches, but also as a country. This is briefly the context and the situation today in Cuba. We've been experiencing a very bad days, mainly from January to September. Many people dying every day, more than 80 people dying every day, pastors, president of churches, artists, leaders. Today is more under control because of the possibility of the vaccination, many other regulations that we established and promoted. Also, we have some churches, you know, not the majority, but also some churches with question about vaccination. But vaccination is very common in Cuba. So we grew up with this capacity to vaccinate people. I have a child that is 8 months old, and every month he receives a different kind of vaccination for different illnesses. So it's not being a huge problem, the taboo of people. So people is happy and people is very open to receive the vaccination, and people trust in the Cuban scientists. So if you have questions, this is a very brief presentation. So we've been serving in other countries as well.
I am so delighted that we were able to hear you and to see you.
One more thing. I want to express the gratitude to the National Council of Churches and churches in the US. For the letters to the President Trump and President Obama, advocating for the release of the embargo, advocating for the good of the people of Cuba. So we deeply appreciate that. We feel the love of the churches in US, in Cuba. So thank you very much on behalf of the Cuban people and the Cuban churches.
Well, we certainly want to receive those well wishes and appreciation, and also to appreciate you and the leadership of the churches in Cuba and what you are doing to be a conduit of this bridge building between nations and peoples in this one body to which we all belong. Thank you for that. I think it's also very instructive that, just as we've heard before from Dr. Collins, Dr. Muchina, and Reverend Bhagwan, there are both the positives and then the negatives, right? There are the challenges and the opportunities. I mean, it is really heartening to hear about the vaccination rates in Cuba. I'm not sure that many would have known that before this moment of disclosure. I'm not sure about that. So we want to celebrate that that is happening and that there is a culture of trusting the medical profession in Cuba, and that there is a culture of trusting each other when it comes to the science. That cannot be underestimated. In the United States, we're finding some challenges with that, where there are fundamental questions being raised about the culture of vaccinations and the culture of science. And what I'm hearing about Cuba is that that particular challenge is not as much of a challenge, whereas the economic challenges, the historic challenges around economics, in part because of the lack of relationship of Cuba and other parts of the world, including the United States, is challenged at best. and that somehow people of faith need to be that conduit of bridge building, which is part of the history of the ecumenical movement. And that is certainly true with the National Council of Churches of Christ. So I just want to pick up on those points very quickly. There's much more we could say, but still to say that in all of these contexts, whether in the US, in Africa, in Cuba, or in the South Pacific, there are matters of urgency to which the moral conscience of the faith community is to be present. Friends, I regret to tell you that there isn't as much time left as we would have liked. What I'd like to do is just very, very quickly is to have each one of our panelists briefly respond to what they may have heard that they want to comment on further, because they've been the ones invited to give us their thoughts and their expertise around this issue. Then we want to spend the remaining time with the questions that have come in the chat. And yes, there are several, and we do want to get to that. So I want to urge our panelists to please be succinct, but we do want to hear if there's like 1 or 2 points you want to address quickly that you have heard from your peers relative to the discussion at hand. So I'm going to come back to Dr. Muchina. I'm going to start with her. We've heard back already from Dr. Collins, but I think we may end there in the panelist response. And then we'll go to Reverend Bhagwan, and then we'll come back to Reverend Ortega Dopico. And then finally, if Dr. Collins wants a quick remark, please, he will be welcome. But again, I want to invite you to be succinct so we can also hear from those who have inquiries. Dr. Muchina, please. I do believe you're muted. Sorry for that.
No, I was saying that I had, Dr. Collins said it took 11 months to manufacture the vaccines here in the US. And I am saying it's taking us more than 11 months to have a conversation about producing the vaccines. I think what we are hearing and what scientists are also saying, we need at least 6 months for companies that are already producing other vaccines. And actually, companies like South Africa, they were already assembling the vaccines to ship them back to Europe. So they do have the capacity to do it within 6 months. And the attitude that it will take too long is a neo-colonialism mentality that is, in my opinion, has always been exhibited by the West towards developing countries. And we need to challenge that and to stop that. And also to remember that, the transfer of technology is important, not only to the countries that are being, asking for that, but also the countries here, because if we don't stop the pandemic where it is, then the new variants will undermine the achievements that we've already made here. So we need to stop vaccines apartheid, because the countries that are actually refusing to help with the TRIPS waiver are the same countries that colonized some of these developing countries. So there is a sense of, vaccines apartheid that we need to address. And we also need to address greed. If we don't address greed, we are not going to save more people as we need to. And kudos to Cuba, you have produced your own vaccine, and we are looking forward for it being available to the rest of the world. So thank you very much.
Thank you, Dr. Muchina. Over to you, Reverend Bhagwan, please. Reverend Bhagwan, are you still there? Oh dear, I think we may have lost him. Let's go to Reverend Ortega Dopico, please.
Yes.
Yes, please. Do you have any further comment you'd like to make from what you've heard?
Repeat again, please.
Are there any further comments you'd like to make before we go to the questions in the chat based on what you've heard? Yes, please.
Something I want to share is that this is there is an issue of power around this. We as a churches, right now is going to be held a meeting in Germany of the Health Commission of the World Council of Churches. People from Cuba and other countries are not able to participate in presence. I am wondering how these illnesses and the issue of vaccination and this pandemic is going to be used for countries or people in power, and politically speaking, to manage this, creating some discriminations. How the difference between South and North and wealth and poor are going to be, how this pandemic can create some stratus in society that can be more discriminated, because the issues, not just of these illnesses that is going on now, but new illnesses that can be in the future. So I appreciate very much this panel and this opportunity, because I believe that as a church, what the theologians are teaching us on the pandemic, how the Bible is teaching us on this, how to be, how we are rethinking in Cuba how to be a church, because we've been a church in these 2 years with no sanctuary, with no gathering, but churches in the community, churches in the neighbors. So all these issues of the COVID-19 and the issue of be vaccinating with this vaccine or not, how the countries are going to accept some of the vaccines or not, which quality of person I am be, depending on the vaccine that I am being received. These are questions that not just for the COVID-19, but for sure in humanity, we are going to address all other illnesses similar than this. Has happened before with the leprosies in the time of the New Testament. You remember these people that was in the margin. So how we can address as a church that people, that we can guarantee that countries and people are not being marginalized because of this.
And thank you for that, because I think that is a running thread that we're hearing in terms of a question that needs to be asked of faith leaders, and what role are we going to play to address that? Dr. Collins, I don't know if you have any response you want to make quickly to what you've just heard, and then we're going to go to the chat.
Well, very quickly, and I regret I'm going to have to sign off in a couple of minutes for something I'm committed to at 5:15. But I did want to respond a little bit to the comments from Dr. Muchina, who I take with great seriousness, is advocating that we ought not to tolerate any kind of delay in building vaccine capacity for manufacturing in low and middle income countries. And I want to associate myself entirely with the impatience that she describes, and that I would never want to be in a circumstance where this was a colonialist attitude. I'm not a person who's connected with any of these companies. I'm a government servant, and I'm just as impatient as anybody I know about moving this into global access. But I do think we have to guard against demonizing the companies, because we need their help. They're the ones who have the skills about how to do this. Without their assistance in building that capacity with manufacturing facilities in places like Africa, it will take even longer. Yes, they are companies that are out to make money, and they're doing a pretty effective job for their shareholders, but we also need their assistance. So just plead that we would approach this. Sometimes, you know, you have to kind of hold your nose a little bit and make a partnership, because it's going to get the job done. That's all I wanted to say.
Thank you, Dr. Collins. I want to go straight to the chat. We're down to just about 12 minutes now, but there is a question, I believe, for Dr. Muchina that says, I would like to know how the churches and other faith communities in African countries are addressing the COVID-19 pandemic, especially on the question of access to vaccines for all. This question comes from Bertha Amisi. Dr. Muchina, have you a response for her?
Yes, and I also did add it on the chat to say that churches in Africa have been on the forefront of the COVID response. And as we know, many of them provide health services in the continent, and they are also involved in community health and community mobilization. which they've been doing like they did during Ebola and during other pandemics. So we've been inspired and encouraged by those churches that have really been there for people. They are the ones who are there for the sick. They are the ones who are burying. They are the ones who are comforting to those who have lost their loved ones. And we also know that they have also been providing food and trying to end poverty in communities that have been badly impacted. However, we also know that some of them have been encouraging people not to take vaccines. And that's something that we are challenging and pushing back and encouraging them to see why the vaccines is important. And we are also urging them, All Africa Conference of Churches have been, we've been working with them and other, denominations and other religious institutions, including the Muslim community. The Religions for Peace is the other one, in terms of advocating for national governments to do better than they are doing for their communities, but also international governments to release the TRIPS waiver in order to save billions of lives globally. So the issue of advocacy really is a priority, and it is not only in Africa, but also here and other parts of the world. Thank you.
And thank you, Dr. Muchina. I wonder too, Reverend Ortega Dopico, if you could speak to this question a bit more in the Cuban context as well, the role of the faith community and its responses as well.
Yes, the faith community, as I mentioned, being serving even like little hospitals in the time of the strongest crisis, but also serving mainly the elderly people, serving food, providing hygienic supplies, and distributing a lot of medicine as well, but mainly in the area of the spirituality, because this is being a very stressful situation for most of the families. Many people lost their jobs, children and young people being out of the school. So in the psychosocial, psychologically speaking, we've been working a lot with the communities, and mainly with children, young people, and elderly people, counseling families and people, but also providing food, providing hygienic supplies, materials, and all kinds of assists. Thousands and thousands of families are being supported by the church. The church is being more relevant, and it's being good that the civil society is being more empowered in Cuba as well, especially the church. Let me finish with that. A huge research was made by the University of Havana, the Center for Studies of Youth and Children. It was a survey on children's, on the children that are being affected by COVID-19. And in the results, they identified, one of the questions was which being the heroes for these children to keep them strongest during the COVID-19 was affecting to them. And they mentioned 4 of them. I don't remember it was cartoon leaders, a doctor that was always on TV counseling, but they mentioned Jesus Christ, that one of the heroes that been supporting them during the time. And they mentioned also the Bible has a book. So to see that in the Cuban society, to see that in a report of the University of Havana, and to see that among the Cuban government research and surveys of the response of this was being very good for us. So the churches have been very, very involved. Not just the pastor, but the lay people and the people closest to others in the neighborhoods and communities in all these areas, not just in the material areas, but also in the psychosocial support, in the empowering the spirituality of the community, the capacity of resilience. Because as I mentioned, beside all the problem of the pandemic and COVID-19, the economical crisis and the social crisis we are experiencing today is being affecting a lot of families as well.
I really want to thank you very much for bringing up this issue of resilience. This is such an important point. We had a speaker earlier at the CUG that was talking about the sense of loss and spiritual challenge, mental challenge in this whole season for all of us, regardless of where the context is. And so to hear in Cuba that the faith community is playing its role to speak to that kind of lament, lament of loss, lament of change. I mean, change is not easy, it's hard. And to know that you're helping to build up the spirit of resilience in this moment, certainly I think is a testimony we want to hear in this space. Dr. Copeland-Toon, I'm going to come to you because I don't see any other questions, but I want to make sure I see that right. And my screen may not be showing me all I need to see. But if there are any other questions that I need to bring in this moment, we have about 5 minutes for that to happen. Can you help me here if there are any other questions I may have overlooked unintentionally?
They are there. There are 2 questions, one from Dr. Leslie and the other one, I don't know who is asking, but Dr. Reverend Robin Allen. Can you see them?
I was just reading something from the chat. I'll read it out. Can we engage with topics like medical waste and energy consumption? I fear these topics may seem insensitive or inappropriate when the party is to get the vaccines to as many as possible, but I believe they are important.
Okay, and then there is another one. How can local US ministries be of help to expedite the process for producing vaccines designed to small countries in need? What can we do? So can I attempt to answer?
Yes, please go ahead. You're free. Yeah. And then of course, if Reverend Ortega also wants to speak, please, you're welcome.
Yeah, so the first one about medical waste and energy consumption, I think that's an important question for all of us. We know that, for example, the continent of Africa produces less waste, but it's actually being impacted the worst by the climate change and by global warming and all that comes with that. So that's a priority. And the fact that a lot of vaccines have been thrown out here because they didn't use them here, instead of sharing them to be used by other people who really mostly need them, is also a challenge. And we know that, the issue of energy consumption, actually, that comes under, climate change, which we are challenging as faith community, and we have to continue challenging, because pandemics like these ones are coming out of the kind of destruction we are doing to the environment. And if we don't stop, it's going to get worse. So as we are talking about vaccines, of course, that's a priority right now to save lives, but we are also challenging the fact that these pandemics will keep coming if we don't take care of the nature or the environment that God has provided. I think the churches in the US, the National Council of Churches, Angelique, and others already know that we've been doing advocacy with the Biden administration, which has to continue. So there is a petition going to the Biden's administration urging them to do more than they are doing. And also we can share more information through the National Council of Churches for you if you want to be part of that campaign. Actually, next week on the 20th for 1 hour, we are going to focus on that during the vigil that's being organized by the interfaith community. So there's a lot that we can do. Of course, there is a People's Vaccines campaign, which is going on, and we are part of it. And, here in all over the world, and we have to keep on asking and pushing back and calling for that People's Vaccines by, not only donations, but manufacturing and also funding, like the special drawing rights at the International Monetary Fund. Thank you.
And thank you. Reverend Ortega Dopico, did you have any comments about the remaining questions as well?
Just to say, in Cuba, we've been always living under limitations, many limitations in all sense. So we know in Cuba how it is to do more with less. And that is the way to do it. Don't lose the the hope, and continue struggling and responding to everything. We have 3 hurricanes during this time. 3 hurricanes going past through Cuba, the embargo, Cuba in the list of terrorist countries. Also, we are now in an energetic problem situation in Cuba because the factories of power energy are not working properly because the maintenance, there is a lot of complexities around, but as I mentioned, the capacity of resilience of people. So we know as a Cuban how it's to be tested for years. So we've been prepared to respond to this. And we have many doctors in Cuba. We have 1 doctor every, I guess, 100 people, 900 people. So a lot of doctors in Cuba, a lot of nurses, a lot of volunteers, a lot of Christians today as well. Churches are growing, and the vocation of people is being a vocation of people being in solidarity, because they're not because we want it, but because the context and the historical, we don't have another way to be. So all this energy, I can say that Cuba is a good example, and it's a lot of learnings to learn from the Cuban communities, how we be managing all these issues. And of course, because always we have less, that doesn't mean that we cannot do better. Sometimes when you have less, you do better. In the area of the energy consumption, for example, and all the areas, because we try to do the best with the less and the little we have.
I think that is a wonderful way to wrap up, that in each of these contexts, the US, Cuba, South Pacific, wherever we are, we do have opportunity to express our resilience. But I also think, because we are the one body, and this was mentioned earlier, and we do need new wineskins for the new wine because we need to be able to prosper and to grow, that this is a wonderful opportunity, even in the midst of lament and in hope, to express the gospel of Jesus Christ. That in so doing, there is hope, and that God's people tend to always want to testify, which is what I've heard today, testimony that says God is with us, that we must find a way to overcome these colonial inequities in order for all the people, not just for some of the people, but for all the people to live into the fullness of abundance that our God has promised. So thank you, Reverend Ortega, Dopico, Dr. Muchina, Reverend Bhagwan in your absence, Dr. Collins in your absence. We thank all of you for what you're doing and for your time today, and for all of those who have been a part of this conversation, may not have not said anything verbally or in the chat. We thank God for you, and we thank you for the inquiries. I'd like to turn it back over to the Reverend Dr. Leslie Copeland-Toome and to the National Council of Churches of Christ, and applaud once again this opportunity to hear the global voices on this urgent issue that faces all of us. Thanks be to God. Ashe, amen.
Amen. Thank you.
Thank you. That was wonderful. That was really powerful. And I know that our participants got a lot out of this. I know I certainly did. I was taking notes. But thank you all for just sharing with us, giving us a good sense of what's going on globally and how we can participate and do more from where we are to make sure that everybody has access to vaccines and that we are all getting out of this pandemic together. Thank you so much. And this brings us to the close of our session and of our day. We do have closing worship together that you will be able to view through WOVA and also through on YouTube if you prefer. But we are so grateful for all of our speakers, for all of the time, all of the expertise, all of everything we've experienced together, even online. this beautiful and wonderful day as God has just, I believe, met us at the virtual CUG Christian Unity Gathering. And I feel like some things are already turning in me, and I hope you feel the same way. Please continue. You can chat people and send messages in WOVA. Please take a break, have some dinner, call some friends, and join us for our closing worship service, which will begin at 7 p.m. this evening Eastern time. So God bless you all. Thank you. Let me just say a closing prayer, but the benediction will be given at the closing worship service. God, we thank you for our time of sharing. We thank you, God, for how we have been blessed, how you have moved even in these virtual spaces. God, our eyes have seen and our ears have heard what we had not known before. And for that, we give you thanks. We thank you for nudging us and pushing us and stretching us, oh God, to be who you called us to be in a moment, in a time such as this. God, we thank you for all of what we have experienced, all of the speakers, all of what they have deposited in us. And we pray that the seeds that have been planted will find good soil and sprout up so that you might get the glory, oh God, and so that your people might be blessed throughout this land and around this world. We give you thanks again, oh God, and we bless you in Jesus' name. Amen. Amen. God bless you all. We will see you soon for our closing worship.
Ashe. Thank you.